We continue with treatment principles, root, and manifestation. There is a saying in Chinese medicine, to treat a disease, find the root. This succinctly summarizes the importance of always tracing the clinical manifestations back to their root in order to treat a disease. This is because, generally speaking, the root is the primary aspect of the contradiction. That is, it is generally primary in relation to the clinical manifestations. As the root is primary, treatment of the clinical manifestations is usually carried out by treating the root. For example, if a patient complains of acute occipital headache, a slight temperature, a stiff neck, aversion to cold, a runny nose, sneezing, and a floating tight pulse, all these clinical manifestations obviously point to their root, which is invasion of the lungs' defensive chi portion by exterior wind cold. In this case, treatment is aimed at the root, that is, expelling cold, releasing the exterior and restoring the diffusing and descending of lung chi. When this is done, all the clinical manifestations will disappear. This is a simple example as to how the various clinical manifestations form a pattern, which, when properly identified using the tools of Chinese diagnosis and pattern identification, leads us to recognize the root and treat it accordingly. In this example, if the practitioner were not skilled in Chinese diagnosis and pattern identification and unable to identify the root, he might set about treating each of the clinical manifestations individually, which would, of course, be wrong. Another example, a patient suffers from a low-grade fever in the afternoon, night sweating, feeling of heat in the palms and soles, a dry mouth at night, and has a red tongue without coating. These are the clinical manifestations that, when properly interpreted, lead us to identify their root, that is, yin deficiency. To treat all the various clinical manifestations, it is sufficient to treat the root, that is, tonify yin. Another example, a patient has an unremitting high fever, irritability, thirst, rapid pulse, red tongue with yellow coating, and very cold limbs. In this case, there is a contradiction, as the patient has a high fever but cold limbs. However, taking all the clinical manifestations into account, we can identify interior heat as the root. The correct treatment is therefore to clear interior heat in spite of the cold limbs. These are due to interior heat obstructing the circulation of yang qi to the limbs, so that there can be the apparent paradox that the stronger the heat, the colder the limbs. Similar examples could be given of original patterns being the root and deriving patterns being the manifestation. For example, a deficiency of spleen qi, the root, may give rise to dampness, the manifestations. A deficiency of lungs, spleen, and kidneys, the root, may give rise to phlegm, the manifestation. A deficiency of kidney yang, the root, may produce empty cold, the manifestation. Qi stagnation, the root, may give rise to blood stasis, manifestation. Cold in the uterus may cause blood stasis. Common examples of original and deriving patterns as root and manifestation. So for the root, we are spleen qi deficiency with dampness as manifestation. Lung, spleen, and kidney deficiency will manifest as phlegm. Kidney yang deficiency, empty cold, qi stagnation, blood stasis. Cold in the uterus, blood stasis. Liver blood deficiency, liver wind. Generally speaking, the root is primary and is treated first. However, under certain circumstances, the manifestation can become primary and needs to be treated first, even though the ultimate aim is always to treat the root. The decision to treat the root or the manifestation depends on the severity and urgency of the clinical manifestations. There are three possible courses of action. 1, treat the root only. 2, treat both the root and the manifestation. 3, treat the manifestation first and the root later. Thank you for your attention.